Cultural Spotlight, presented by the Marion County Public Health Department.
It all started back in 1915. That's when Booker T. Washington established the National Negro Health Week, which later became the National Minority Health Month, which is now celebrated every April. The goal is to build awareness about the health disparities among racial and ethnic minorities, encouraging everyone to take action to end inequities. With more, we are joined now by WISH TV contributor Gloria Jimenez. We are always glad to say welcome to. Thank you so much for joining us.
Thank you.
All right. The theme this month is Be the Source for Better Health. Can you tell us more about this?
Yes. So this month is to address disparities and to promote equity by improving access to health care, reducing barriers to services. And I think the theme is connected to the immigrants, the new immigrants that are coming, and the refugees and the marginalized groups here in America, and to understand the difference and the barriers we have in the healthcare system, but not only there, but also in, like in institutions, the community, government, and to understand more the new culture and how America is changing and how we have to start changing a lot of our policies, procedures, and the stuff to be more inclusive.
Yeah.
All these groups.
Absolutely, that makes sense. Let's talk about the Latino community in particular. Let's zero in on that. When we talk about these disparities, what causes those disparities in the Latino community?
Yes, number one is the socioeconomic factors. A lot of immigrants, they experience extreme poverty. And the other part is that healthcare, it's very expensive for them. Mm-hmm. And the number two, it's very connected, their immigration status. They don't qualify for a lot of the benefits that American citizens get because of their citizenship.
Right, yeah.
The other parties would be language barrier. When they move here, they don't understand any English. They speak muy poquito, so that's a huge barrier for them.
Yeah.
Not understanding when to go to the doctor and the checkups, and for the little ones especially. And the other factor, it's very connected, the cultural factor and the discrimination. If you don't feel that you belong to your work, your neighborhood, and wherever you visit the doctor, or for schools, especially for little children, it's very difficult to be accepted, and they feel like they don't qualify for any of this.
Yeah, kind of marginalized,
yes.
Ostracized, that
yes.
kind of thing. We have just a short time here, but I want to understand, if you can tell me, how do we educate different communities about exactly what's going on? Some of the things you've said.
Yes, so both areas, you have the community, but also institutions like government, universities, corporations, to educate both parts through community outreach, creating collaborations, a lot of posting on social media and talking about these topics, empower individuals through advocacy. And then from the other parties, inside their institutions and companies, offering trainings and workshops, providing resources and tools, educating about the culture of their employees, and create the collaborations between nonprofits and even the neighborhood associations that there are in our cities, so we can understand the barriers and we can create less disparities and create more inclusivity, and that will help to create the diverse and inclusive initiatives that cities should have with the healthcare and the neighborhoods.
Yeah, that would definitely be good. We're out of time, so we have to leave it there, but I really appreciate your time. That is WISH TV contributor Gloria Jimenez. Thank you so much for your time today.
Thank you, Zachary.